Good morning to you, and I'm delighted to be here. And just a word about the Fostering Network for those of you who don't know us. We're a UK charity and we're a membership organisation. So across the UK we have about 37,000 fostering families, it's about 55,000 foster carers who are all members, and in addition to that, all local authorities or health trusts in Northern Ireland, about 2 are members, and almost all of the independent fostering agencies throughout the UK are also our members. That includes those in the private and voluntary sector. And we work with all of those to help them and assist them to do the best job that they can, and also to influence and inform policy and practice. So that, in a nutshell, is the Fostering Network. Yesterday, when I was actually thinking how I was going to nuance what I was going to say today, I was with a foster carer who was involved in one of our pieces of work at the moment, and he and his wife are retired. He's retired from work. They've been fostering for many years. Their own children are now grown up, and they have 2 children currently who've been with them for 5 and 4 years, both in the very early years of secondary education. And those children are doing well, having had quite a difficult start, and they're now making up for lots of missed time in their education. So they've overcome quite a lot of difficulties. He and his wife were slightly traumatised as 3 days before they were suddenly informed that one of the children who'd been with them for 5 years had been taken by social workers from the school and was not coming home. They were not given any reason for that. The other child, who was also at school, was considerably upset by that, had no idea why one child was leaving, and had no idea if they were going to be removed as well. The foster carers, who I say are both very experienced and very able, had no idea why the child had been removed, and had no idea whether that meant the other child was also going to be removed. They managed the next day to glean that the local authority were not going to remove the other child, and that the child who had been removed because of concerns, but the concerns were unspecified. And that's where they were 3 days later, not knowing why the child had been removed or what happened. They had, of course, gleaned or put together that the child who had been removed had been very clear about wanting to go and live with her auntie. They weren't opposed with that. There were some worries that I think they and the social workers had about that proposal, but they weren't opposed to that. And they were waiting and working, assuming they were working with social services on the plans. So they kind of guessed that it had something to do with that, but she hadn't gone to live with their auntie. But they had no idea what the concerns were. Now, unfortunately, I don't have an ending to tell you of that story, because that story is unfolding. But I think what it demonstrates is some of the challenges of foster care, that at its heart, we trust foster carers with the day-to-day care of some of the most vulnerable children in our country today. And we trust those foster carers with children who have often been abused or treated by the families, who come with all sorts of baggage into their households. But actually, the moment things can start to go wrong, we no longer regard them as full partners in the venture of providing care for these children, and suddenly a whole range of other priorities and issues can take over. That leaves the foster carers completely bereft and unsure of what is happening to the children that they're caring for or what their plans are. And I think what we know from research is that actually children who do best in foster care do best because they've got good foster carers and good relationships with them. So looking after foster carers and ensuring that they are empowered to have relationships with those children is absolutely critical. Anyway, what I'm going to talk to you about today is something about the challenge of children in care. And I thought what I'd start by doing is just giving you a very quick overview of what happens to them and who they are. Say something about our approach to children in care, and particularly the challenges laid down by the Secretary of State, Michael Gove, in his address at the end of last week, setting out what I think is a different approach for the future, and challenging us all to be responding to that and thinking through how we are going to meet the needs of children in care in the future. And then finally, a couple of words about the roles of schools and the importance of education for children in foster care. Firstly, to say that children in care are a diverse and dynamic group, and that as this graph shows, the numbers of children in care has been increasing generally since 1994. And you'll see the sort of hump in the middle, and it started to go down in 2004, 2005, 2006. And then we had what is roundly known as the baby P effect, and the numbers of children in care since then have been going up year on year. So we now have 67,000 children in care. And I think that if I'd spoken to you a year ago, I would have been saying that I think we may be beginning to see the curve flattening out as numbers of authorities who are now reporting no increase, and that while some were still reporting increase, numbers were feeling that they had got more effective child support services and family support services that were beginning to bring the numbers coming into care down. But among the remarks Michael Gove made last week was that he thought that thousands more children needed to be removed from their families, and if that's the approach of government, then I think we can expect to see continued increasing numbers of children in care. Important to understand that of those coming into care, about 41% are 4 or under, so a lot of very young children, but equally a lot of much older children. 42% are 10 and over. So there's a full age range of children coming into care. They don't just come into care when they're babies, they came into care when they're older children as well. Interestingly, in much of Europe, the age range of the children coming into care is much older, with far fewer babies coming into care. And about 70% of children in care come into care on a legal order, and not as a result of a voluntary arrangement. And overwhelmingly, children will have suffered some abuse or treatment, so it's a group with very challenging situations. And where do they live when they're in care? 64% live with what's rather ungenerously called unrelated foster care, but that's to distinguish it from family members who become foster carers, as a further 11% live with family and friends. So about 75% of children in care are living with foster carers. That's where overwhelmingly they are. A very small number are placed with parents, a small number for adoption or in independent living, and about 9% in residential care. So overwhelmingly, children in care live in foster care. And that's been, I think you will have access to these overheads, and you can take that table away, but I'll talk to the graph which displays it rather more graphically. But as you can see from that graph, the top line is the number of children in care as a total, and that's the same as the earlier graph. It's gone up slowly, but still looks like it's going up. The next red line is the number of children placed in foster care. And you can see from that year on year the number of children in foster care has increased. Even when the total number of children in care came down, the number in foster care has increased. And that's an enormous credit to the local authorities and independent agencies who have found those foster carers and for those children. But the number of children in foster care has increased year on year, and my guess is it will continue to do so. That, however, is not the next line, the sort of purple line, shows that the number in local authority foster carers has remained pretty much the same. It went down and it's gone up slightly. And the light blue line, which has gone up sharply at the bottom, shows that the number of foster carers placed with foster carers in the independent sector has grown significantly. So very largely the increase in the numbers of children in foster care are accounted for by the success of the independent sector in recruiting foster carers. And that's been quite a dramatic increase over the last 10 years or so. And then at the bottom, the number of children placed with family and friends as foster carers has remained very much the same. But I'll say more about that in a minute. And the number of children in residential care has also remained almost identical. So despite the rise in the number of children in care, the number of children in residential care has remained very much the same at about 6,000. So that's very simply where they live and a key trend in placements. There's been a lot of debate in the last year about adoption, and I think the government's intention to place more children for adoption is well known, and their very robust criticisms of the current adoption system are equally well known. So this is not my slide, it's a borrowed slide, but the credit is at the bottom. But what this shows is what's called the pathways to permanence. So the blue at the bottom is the number of children placed with adopters, the number of children in care who have been placed with adopters. And it's gone up and down a bit, but it's remained pretty much at the same level for a while. What's interesting though is the light purple and dark maroon lines, which show the impact of residence orders and special guardianship orders. And the light purple line, the pinkish section with special guardianship orders is the most interesting. And since the introduction of special guardianship orders in 2006-2007, we have seen that they are a very popular order from care proceedings. Overwhelmingly, those will be to relatives who have come forward when children cannot be looked after by their own family to offer a home to those children. In the past, many of those would have been in care orders, and so we think that that's the increase of that is a result of an increasing number of relatives coming forward, being found for children in care. But those are very clearly permanent placements. They're placed with relatives who the state is intending that those arrangements are permanent and that they will grow up with those relatives. So actually, if one looks at the overall picture of the number of children, if you like, placed with permanent arrangements who have come into the care, we actually see that that has increased significantly since 2005, very largely as a result of special guardianship orders. Although the number of residence orders has also made a difference, it's important to note that that figure only started to be collected in 2005, so it might be that that line would have continued on had it been there before. But we do know that the number of children with special guardianship orders has increased significantly. And I think that's important because it shows very clearly to me that whatever one thinks about adoption, and I'm sure there's room for significant improvement, actually there is a tremendous focus from local authorities and in care proceedings on finding permanent placements for children whenever possible, and quite rightly, in my view, that's, if at all possible, that's with relatives and family members, before it is with strangers as adopters or with strangers as foster carers. Just a word to say about outcomes for children in care more generally. We do know that there are worries about children who return home, and I think the latest research has shown that the children who return home often do not do as well as children who remain in care. But there are worries also about the level of planning and thought that goes into supporting those arrangements. We know, those of us who work in the system, that an enormous amount of planning and thought and support goes into placing children with foster carers or adopters, or even with special guardians, but much less often goes in when they're going home, even though you might argue that even more thought and planning needs to go into supporting those arrangements. So there is worry about children who go home. What's also very clear from the research now is, despite some of the publicity around care, it's pretty evident that children who come into care and remain in care, leaving aside those who are adopted, actually do better than they would have done if they remained at home. You might say, that's not great, we should be doing much better than that, and I'd agree. But very clearly, the research shows that actually most of those children do better if they come into care. It further shows that the fact that the longer children remain in care, the better they do, and that other things being equal, that whether you are fostered or adopted, what makes a real difference in your outcome is the age at which you were placed and what happened to you before you came in care, and not the legal status that surrounds the arrangement of your placement. So as I say, children going home don't do well enough, children in care do better than they would have done, but not well enough. And I think we sum it up at the fostering network by saying that the challenge for the care system of children arranged in care is that children move too often, leave too early, and don't do well enough. Despite the fact that they do better, it's quite clear that they don't do anything like well enough. And if you follow the latest statistics on care, you'll be all too well aware that the general level of children in care getting to university is about 6%, and that's really very poor, and everybody is clear that it should be much and could be much higher than that. And similarly, if you follow the figures on those not in education, employment or training, worrying increases in the numbers of children in care who are featured in the NEET figures. So clearly there's a real concern that as children get to an older age, that they're not being as well served as they should do. Just a word before I go on to principles of strategy. What's interesting is with all the current concerns about permanence and how well we're doing for children in care, and all the current debates that are around, a group of 7 charities, including BAF, Family Rights Group and the Fostering Network and a number of others, have set up something called the Care Inquiry, and we're concerned to use that to look at actually what does the evidence say about what works for children in care, what does the evidence say about how you can most successfully ensure that children coming into care do achieve stability and security in any future arrangement, whether that's adoption or fostering or special guardianship or going home, and how can we ensure that those placements do meet their future needs as well as is possible. And we have got the inquiry is focused around 3 sessions, and in the new year we will be coming out with some recommendations. If you want to know more, do look at the Fostering Network website where you can find a link to the Care Inquiry. I want to say something more now, just talk to you a bit more about the principles and strategy that really informs our approach to children in care. I think that what Michael Gove set out last week very clearly was a view that more children should be coming into care more quickly. In his talk to IPPR, he very clearly used the phrase of the needing to rescue children who were in appalling circumstances, and that the state wasn't quick enough and speedy enough to rescue those children. And as I said, he talked about the need for thousands more children potentially to be in care, and he was challenging the thing that the system was putting the needs of offending adults before the needs of children. So it was a challenging, confrontational speech that you would expect from Michael Gove, laying down a challenge to the sector about our approach. But very clearly seeing that the state needed to be much more proactive and much more robust in its approach to removing children and rescuing children from situations where they will be inadequately looked after, ill-treated or abused. Now, at one level, it's very hard to argue with the fact that if children are being in appalling situations and they're being ill-treated, they clearly need to be removed. So at one level, it's very hard to argue. But another level, I think what one needs to recognise is that actually the way the state removes children from families, one needs to decide whether that's the centrepiece of the policy, or whether that's part of an overall strategy to support families in their tasks of bringing up children. And many families will get on with the task of bringing up children without the intervention or support from the state. But we do know that numbers of families do need support from the state, and whether those through Sure Start, children's centres, or the other arrangements to support families, those family support services are very critical. We also know at the moment that with the changes in the benefit rules and under occupancy and housing benefit rules, that an increasing number of families are going to find themselves in very, very dire states. So I think the question that I think we need to ask is whether the role of the state in removing children needs to be seen as part of an overall family support strategy to support the most vulnerable families, to make it more possible for more of those families to meet the needs of their children, and in exceptional circumstances, absolutely, yes, remove those children from their care, or whether the need to rescue families needs to be seen as the centre of a new approach to how we are thinking about intervening in family life. And I think that the new approach, if you like, that the Secretary of State was outlining was very clearly, in my view, going contrary to many of the principles that are currently within the Children Act. Now, the 1989 Children Act, which has at times been rightly criticised as being not properly implemented, certainly set out very clear that the primary responsibility for bringing up children rests with parents, and that the state has a clear role in supporting and helping parents, particularly those who need that help, and that the state should only intervene when children are harmed or at great risk of being harmed, and that in all circumstances our primary concern should be the child. So there the state was setting out its responsibility to remove children very clearly with an overall family support package, and I think that's markedly different to the direction that the Secretary of State is challenging the sector and encouraging a debate in the sector about how we should move forward. So I think there is a debate to be had and that we need to respond to this. Finally, I want to talk a bit about improving outcomes, which I think we have to focus on improving foster care. Not that I don't think we need to work on adoption, not that I don't think there isn't work to do on children in residential care, but 75% of children in care live with foster care. If we're concerned with improving outcomes for children in care, as we must be, then we have to focus on improving foster care, or we will miss the chance of improving outcome for most children. And I think if we're looking at the improving outcome for foster care, then actually one of the challenges for the state is that the state can restructure services, it can reorganise the legislation and introduce new policy. But what we actually know makes the difference to children is the quality of the relationships they have with the people that are close to them. And that's the thing that is most difficult for the state to do anything about. So there's a real challenge for the state is it a need to change the legislation? Is there a need to change policy? Or is there a need to really focus on what we can do to improve the quality of the relationships with the people who are closest to children? And in the case of the 75% of the children, that's foster carers. And I think there are strong arguments for saying that we must be investing and supporting an approach that is looking to strengthen the relationship the foster carers have with their children, and actually that's very much part of the current government policy. We have to be looking at an approach that is strengthening the role of foster carers, yes, certainly holding them to account if they do not do what is expected, but we have to give them the trust and authority that we have done when we place the most vulnerable children with them, and ensuring they always have the information they need. And I think there is a key role for schools and education in this, not just because we know that actually doing well education is a critical factor in one of the critical factors in how you're going to perform later in life. But we know that for many children in care, still despite the changes in legislation, they're not in the best schools, and that we need to do more to ensure that they are in the best schools. We need to do more to ensure that the schools feel confident about working with foster carers who are really local parentis of these children, to be helping them to meet their children's needs. But actually, whenever a child comes into care and moves to live with new foster carers, it will inevitably be a consequence of disruption to their lives. And we know that the first months, the first 6 months, the first year with foster carers is an absolutely critical period for children in terms of their ability to catch up and make up for whatever difficulties they've had before. And that requires an investment of resources and help at the very early stages in placement that can save an enormous amount of difficulty later on. The pupil premium, which again we're hoping the government will increase for children in care, is very critical. And the access to specialist help when it's needed later on if things are not working out is critical. So to sum up and finish, I do believe that actually care does work for many children in care, and there is certainly evidence that for children coming into care, it's often a better outcome for them than it would have been had they not. Equally clear that there is absolutely no doubt that we must do much better for children in care, and we can do much better. And that the very low educational outcomes and the lack of support for children leaving care is a crime, really, and we are undermining much of the good early work that we do if we don't support these children for far longer. It is criminal, really, that children in foster care, that most vulnerable group, are almost all leaving their foster families by the time that they're 18. It's absolutely criminal. We don't do that to our own children, but we're prepared to do that to the most vulnerable group of children. And I think actually that undermines much of the good work that happened earlier on. But I'm equally confident that actually our strategy for working with children in care must be seen as part of an overall strategy that sees support to families as critical in how we're helping the most vulnerable children in our society today. Thank you very much.
Thank you very much indeed, Robert. Can you hear me with this? Is that all right? Can you hear it back? Yeah. Yes? Good. Thank you. Well, I think that set the scene for us, as well as in terms of fostering adoption and some of the issues for young people in care, and also anticipated the shift in emphasis at least, which may be qualitatively significant in current government policy, which is a challenge to the sector, and I think Robert set that out very clearly for us today. Let's see if any of you have some observations, comments. We've got a range of people in the audience here, not just local authority workers, but people from schools, people from voluntary organisations and other parts of the sector working with children and young people and interested in them. So anybody like to start with an observation or a question? Yes, could you, when you ask a question, could you say who you are? There's a microphone coming to you now. Thank you.
Specialising right from Christchurch University Research Centre for Children, Families and Communities. What I really is in a way is taking up on that last point, there is almost a throwaway line about children leaving care and leaving foster care. And I know we've done some work which it shows how devastating it is for young people, how abandoned they feel when the care that they've had in foster care just goes, and they're meant to be independent, which, as you say, we don't do for our own children. We keep the support mechanisms there. What do you think is the answer to that? I mean, obviously, presumably good, I'm sure good foster parents do keep in touch, but it's not the same in terms of that constant, that knowing that the safety net is still there. And also the other thing that I know quite a few local authorities have set up mentoring schemes in terms of the focus on academic achievement. Sometimes sort of overtakes that building a good relationship, that needing of social support, that understanding that you just need the need to know that somebody is there who cares. Have you got any?
Thank you.
I expect you to have answers, but...
Thank you. Robert?
Yes, the issue of leaving care, I think we have to grasp the nettle and find ways of simply being automatically able for children to remain with their foster carers, and for those foster carers to receive financial support at an equivalent level, which is not the same as being paid exactly the same, but at an equivalent level, until over 18, whether it's 21 or whatever the age group. And I think we would see more children remaining with their foster carers. There is going to be a cut-off point when the state says, no, we will no longer do that. But actually 18 is now just out of step with where we are in society. So I think we have to grasp that. I don't think it's as expensive as we fear, because not all children will take it up. But I do think that the challenges are that the financial burden on that will fall very clearly on children's services. The benefits, the financial benefits will be felt in adult services, prisons, mental health services, benefit system later on as children do better, which doesn't make it easier for directors now. I also think what we have to do is, I think it would help if we actually constructed, there is no status for long-term foster care. It doesn't exist at the moment. And I think that makes the relationship between foster carers and the local authority often difficult. And it makes it difficult to have those conversations about what you're going to do when the children has left care, because the local authority is a bit ambivalent about how it's going to support. So I think if we did have a clearer status about long-term foster care and a clearer expectation that actually that would mean that foster carers remained in touch, would continue to be involved in the young person's life even after they'd left, whether they were living there or not, then I think that would make a difference. But I think if we're going to have that clearer expectation, we've got to be prepared to fund and support foster carers for longer. On the educational, I feel a bit mixed about this. I'm old enough to have been practicing in the 70s and 80s when there was a great concern about emotional welfare and not enough attention on children's educational performance. And we thought we must sort out their emotions first, and actually children suffered as a consequence. Because every now and then I think what we need to be saying to children in care is your life is going to be tougher as an adult because you haven't got a family behind you in quite the same way that most families do. It's important you do well at education. It's even more important you do well educationally than it is for many people. So I think that I don't think I have seen an overemphasis on children's doing well educationally when they're in care. And I think we still hear of examples where children are involved in discussions about when they're going to leave foster care in their GCSE year, which is quite clearly an abomination and should be banned.
Perhaps just for information I could add on the 18 plus. The previous government instituted, as you probably know, some pilots called Stay Put in a number of local authorities. And they concluded in March last year, 2011, and the evaluation was published early this year. Coincidentally, we had a question on this in the House of Lords yesterday, so I actually challenged the Minister to say whether the government, in the light of that evaluation, because it's quite clear, actually local authorities aren't doing this, they're not implementing the benefits of that study very widely at all, whether the government would consider an entitlement for a young person to stay in their placement. And of course, Staying Put only looked at foster care, didn't look at residential care. So an entitlement to stay in their placement with obvious requirement to support foster carers if they did so, if it was in the interest of the child. And I'm afraid he did just say it was up to local authorities, so I don't think the government is going to change the law anytime soon in relation to an entitlement, which I think probably is the stimulus that's needed, putting the needs of young people first in the legislation, but I don't think that's going to happen from the answer I got here today. Okay, we've got time for another quick question if anyone would like to come in. Yes?
Hello, I'm Diane Roberts, I'm the midwife safeguarding Middlesex Hospitals Trust. I just heard my questions from the other end of the spectrum. I know from personal experience and from experience with colleagues that the recognition and treatment to attachment disorder, which is really common, it seems to be underdiagnosed and under-resourced, which then sets up the foster care and then prospective doctors to set up to fail. And I just wondered if there's anything going on in research or changes to support networks of that.
Two things to say, really. I'm not sure that I'm going to adequately answer your question, except to say that I think attachment is recognised as absolutely critical in foster care, and there are a range of training courses and work that really supports the centrality of attachment and attachment issues. Fostering Network, we've just completely rewritten our safer caring guidelines and our safer caring guide for foster carers and fostering services, and seeing that as part of the importance of that approach, as part of creating good attachment between foster carers and children. So I think it is recognised, and I think it is recognised as central. The key is ensuring that there's good access to support and help when there are difficulties with that. I also think the work of Stephen Scott at the Maudsley has been potentially very helpful here. And I think one of the things that he's found is that children with really difficult attachment to their parents can actually form good attachment to the foster carers, even though their unresolved difficulties with their parental attachment remains. So it's possible to have, it is possible to make growth in one place, even when you have the unresolved attachment difficulties with another adult. And I think that may be very helpful to foster care and foster carers in helping them see that they can help children make a difference, and that they can make a difference to their lives, even while the longer term efforts of how you recover, accommodate, make sense of the earlier difficulties is going to remain for a long time. But you're right, attachment is an absolutely critical issue for all children in foster care and for foster carers.
And also for social workers and social work trainees, dare I say, a perennial issue. Yeah. Okay, I'm sure we'll pick up some of those issues later on in the day. For the moment, I'd like to thank you, Robert, and I know you have to go.